Here we are again back in the Ritz-Carlton, aren't we? We're happy. My name is Natalie Lyons, and I'm the Center Director for the National Resource Center for Adoption. And I would like to personally welcome you all to the 2011 Children's Bureau's Policy to Practice Dialogue. Yay! The theme this year is making it work in child welfare, and we all are so thrilled that you took the time out of your busy work schedules to be with us again this week in DC. I am really just going to give a few hello and get out of the way because we have some pretty dynamic people that are going to be speaking with you today. I'm wondering if the planning committee for this year's dialogue, if they could all stand. Don't be shy. Stand up. These folk have worked extremely hard to make sure that we have diverseness in our presentations to really meet the needs of all three groups, which are the adoption managers, the foster care managers, and the in-home managers. So we really were trying to be strategic in what we have to offer you these 2 days. We want to make sure that your time spent here is a good use of your time. We understand that you're very busy people, so I think that you will be quite pleased with the offerings that we have for you in these 2 days. And the way the schedule will really work is that we will start with a general session this morning. We have our commissioner here, and I'm so thrilled that he's here to be with us. So he will be doing our opening sessioning, our opening plenary on the well-being of children in care. Then we will have a break, 15 minutes. We all synchronize our watches, 15 minutes, because at 10:15, we would like you all to go to the breakout sessions. And when we have our breakout session cluster, we have 5 breakout sessions in a cluster. The capacity for those breakout sessions are 50 per session. So, some of you might, look and see that you might want to do some more than the others. If your room should get full, we really ask these presenters have come on their own time to be with you. If we could just kind of spread it out a little bit and make sure that we're all listening to all the good information that they have to share. Then at 11:45, say with me, 11:45. 11:45, we are going to have a phenomenal awards luncheon. It's going to be a wonderful, wonderful time, and you don't want to miss it because we are going to give the award to the Ellen W. Carey Scholar from Howard University, which is going to be tremendous. We're also going to present our Adoption Excellence Awards to those awardees from 2011, which is also going to be tremendous. And then we get a special treat. We get to see the unveiling of the 2011 public service announcements from the National Ad Council on Adopt Us Kids. And not to be let down, we're going to be finished at that time with a preview of the 2011 National Adoption Month website. So that, with phenomenal food, you don't want to miss it. So 11:45, and Miss Ingrid, that's going to be in a separate room, Salon 3, which is on the other side. And you know what? There'll be people there to direct you that way. We will have another break at 1:30, and then we'll be back in this room for another general session. Don't miss that either because it's going to be great. Anita Barbie, she's really funny. We want to come back and talk about adaptive leadership. We'll have another break with a few treats, and then our last breakout sessions will be at 3:30. Now, this evening, that seems like a chock-full day, doesn't it? Ending at 5. But because we wanted to make sure that you all had the opportunity to network, we're going to have a phenomenal manager's reception from 6 to 8. And Ingrid has assured me that she has got tasty, tasty treats at that manager's reception. It's being hosted by the NRC for In-Home Services, the NRC for Permanency and Family Connections, and our NRC for Adoption. So we hope that you would just take time to come and network with your peers. There's something about being in the same room with everybody and being able to talk and network that you just can't get over the phone or through email. So we really hope that you take part of that reception from 6 to 8. And then early the next morning, because this is a high-level working meeting, we are going to start again at 8:30 with breakfast, a delicious fruit fair at 7:30. We will have our general session, and we'll have a personal testimony. A nice young lady by the name of Nicole Dobbins will talk about her experiences. She's awesome. She will be with us at 8:30. Then at 9 o'clock, we will have the collaboration approach to approaching social, emotional well-being for children and youth and families and child welfare. We'll have a break at 10:30. We'll have another general session with Adopt Us Kids and the Children's Bureau's Training and Technical Assistance Network. The TTAC representative, Melody Rowe, will be here to talk to us a little bit about that. You'll have time to have lunch on your own, and I'm hoping that you'll meet some new people during the networking reception, and then y'all can go off and have a fabulous lunch. There's plenty of offerings. If you notice, my little thing is that we're connected to a mall. In the mall, there's a food court. So you can go off and have a fabulous lunch and then come back at 1:15 where we will talk about data. Yes, data, yeah, woohoo for data. And then we'll have our last set of breakout sessions at 2:30, and then at 4 o'clock, the dynamic, don't want to miss it. Reason why you're here, federal updates, and we'll have a panel of our feds that will be here to give the federal updates. So that's just a little bit of the overview. Jam-packed 2 days, huh? Pretty jam-packed, but I guarantee you it's going to be well worth your time. It will be. A couple more housekeeping things. We want to make sure your time here, because we have so much in these 2 days, we want to make sure your time here, you're as comfortable as possible. Anybody who has these little green tags that say staff on it, they are here to answer your questions and make sure that you're taken care of, you're getting to the right rooms. Don't hesitate to ask. They'll greet you with a smile. Ingrid Parks, I have to give special shout outs to her because she has done a yeoman's job. This is the 3rd year that she's kind of put this shindig together, and I just want to, I guess I shouldn't call it a shindig. She's put this meeting together. She is here also for you to if you have questions, you can always ask questions of me. I'm here for you too. So that's that. And then the last thing, because money is important, you have in your packets your travel reimbursement guidelines for those sponsored participants, for those in-home managers, foster care managers, adoption managers. The Children's Bureau sponsoring your way here, and there are directions along with an invoice on the back of that. So we ask that you would save your original receipts and that you would, follow the guidelines and then get these sheets back to us. And then the fabulous Ingrid is reminding me, questions. During the question and answer period for the general sessions, we have staff that have lav mics that will walk around to you to answer your questions. So you notice we don't have the 2 rows where you come up and you might be a little intimidated to come up and ask your question in front. We're going to bring the mics to you so that you can ask your question. So all we would ask is that you would, when that period of time comes, raise your hand and we will make sure that we can facilitate that Q&A session for you. So I hope that you enjoy this meeting. And again, if there's anything that you need, don't hesitate to ask us. And now I'm going to ask the lovely O.J. Morgan to stand up and give the official Children's Bureau welcome.
Thank you, Natalie. Can folks hear me? Good morning. I'm Jane Morgan. I'm the director of the Capacity Building Division at the Children's Bureau, and I want to join Natalie in welcoming you to the Policy to Practice Dialogue. This is a very exciting and important meeting for us, and we really, as Natalie says, it's a jam-packed, intensive, working meeting that we've got planned for you, and we're so pleased to see you here. The first thing, I want to take this opportunity. This is a huge group. This is amazing. And I would like for us to figure out who we are. We don't have time to go around and do individual introductions, but I'd like to just get folks to stand up. First, let's see all the adoption managers. Would you just stand up? All right. Great. Okay. Now, I have to say, this next part may get kind of hard because, well, maybe not. We, yesterday, the NRC for Adoption hosted a TA event on post-adoption services and brought adoption managers in. We had 75 folks attend. It was awesome. But when they went around and did introductions, so many folks are wearing multiple hats. So some of you may stand up a lot. Anyway. So, would those who are in the foster care manager's role here please stand up? All right. And then the in-home services managers, would you guys stand up? I don't know if any of you stood up 3 times, but God bless you if you did. But we're here to work with you and help you. Now, I'd like to see the members of the Training and Technical Assistance Network stand up. We've got National Resource Centers, Implementation Centers, the Coordination Center, Child Welfare Information Gateway. Did I miss anybody? We are thrilled that Youth Development, they are an NRC. Very special. We are so glad you guys are all here, and they're here to be resources and work with all of you from the state. So thank you. And then, and last, I'd like for the federal staff to stand up. Great. There aren't a lot of us. But I have a great team. We have a great team at the federal level, at the Children's Bureau, and we're here to serve. We're here to help you. And there's some other folks that are going to be joining us later in the morning. Okay, give me a moment. I got to get my technology going here. I do want to give a shout out to the planning committee. I know you worked really hard, and Natalie and her team in putting together and hosting this event. I do want to especially recognize Permanency and Family Connections, Youth Development, NRC for Adoption, Adopt Us Kids. Did I miss somebody? And In-Home Services. Lisa, where is she? I'm going to get in trouble. For all your special work on this, because I know that you spent a lot of time over the last year thinking and working together and also outreaching to all the states to bring folks in. I just want to really acknowledge there's a reason that the Bureau brings in managers at your level to these meetings each year. This is part of our federal role is convening our grantees. You are our grantees at the states. And we have found in our work with states that middle managers, managers at your level, play an absolutely pivotal and critical role in improving child welfare systems. In our work with states around program improvement, we began to see as we were working with states and we were hearing from our national resource centers that, and we were seeing states that were really engaged in exciting initiatives, working to improve their systems. And where that was successful, it sometimes had a leadership change at the child welfare director level. Child welfare directors, their terms are 2.5 years, 3 years? We all live that. I lived that in Oklahoma. Their child welfare directors at that level often are changing, but what we have seen is where we really see sustained improvements is often because the managers, like you, are still there. You're carrying those initiatives forward, but that takes some real skill to move from administration to move initiatives forward. And doing that is a really exciting, challenging thing to do. But we've come to believe that it's absolutely critical that for us to support you in that work. And I just want to mention a couple of things that the Bureau has done, and I want to be sure you're taking advantage of it. In 2004, the Children's Bureau funded the National Resource Center to provide minority adoption leadership training. We were very blessed in our funding in the legislation that authorizes the NRC that we could fund them to do this kind of training. And they have put together what we all call the MALDI, the Minority Adoption Leadership Institute. And I would love to see how many of you in this room are either mentors or mentees that have gone through the MALDI program. Oh, stand up. Come on. Okay. All right, now don't sit down. Just take a second. Now, In 2008, the Children's Bureau funded the National Child Welfare Workforce Institute. And I think you're going to be hearing from them sometime in the next 2 days. But one of the things we funded was the Leadership Academy for Middle Managers. And they're offering that across the country. Can those who've gone through that training please stand up? Okay, you guys are going to be busy. I want everybody else in the room, as these 2 days go along, talk to these folks that have gone through this training about their experience, and when the Maldi's about to start another class, which is a 2-year class, right? And Leadership Academy for Middle Managers is going all across the country. So if you have an opportunity for you to go or your staff to go who are in your teams, please take advantage of that. We really are trying to bring you an opportunity to build your skills around leadership and focusing on things like adaptive leadership, implementation science, just how you manage in these challenging times. So if you can take advantage of that, that would be great. So you guys are going to be busy. Find these people and talk to them about what a great experience they've had. Thank you. Now, with that, it's my pleasure to introduce the Commissioner of the Administration on Children, Youth, and Families, Brian Samuels. Commissioner Samuels comes to ACYF from Chicago, where he served as the director of the Illinois Department of Children and Family Services from 2003 to 2007, and as the chief of staff of the Chicago Public Schools from 2007 to 2009. In both roles, he brought much-needed attention to the role of trauma in the lives of vulnerable young people and introduced a cadre of evidence-based practices to address the trauma-related symptoms of students and children in foster care. Since joining ACYF, Commissioner Samuels has continued to champion the well-being of children and youth. Those of you who have had an opportunity to hear the Commissioner speak know that he has clearly articulated a vision in which ACYF programs target the social and emotional effects of trauma, maltreatment, and exposure to violence to promote healing, recovery, and healthy, positive functioning of all children, youth, and families. This vision builds on the work the Children's Bureau has been doing for the past 100 years and presents new and exciting opportunities for the next 100. It permeates our funding announcements, our discretionary projects, and mandatory programs, and yes, our meetings. So with that, I'm going to turn the program over to Commissioner Samuels.
Thanks and good morning, everyone. So I'm going to check my watch here. We have about an hour on the schedule, and so what I will try to do is keep my presentation to 45 minutes and then allow some question and answers. The presentation, as it's organized, is in part to engage you. It's also to challenge you. The presentation will also make you think about some of the basic assumptions that we use in our work in child welfare. And I think for many of you, the presentation will offer you an opportunity to do the very thing that you entered this field to do, which is to improve the well-being of children who have been abused or neglected. The presentation at times will feel a little wonkish to you because I'll throw some data at you. But we've also made sure that for those of you that like words and not data, there's some words in here too. Ideally, what this presentation will do is to really challenge you to use the next 2 days to learn and to grow and to gather and to get to a place where you can articulate the way in which, in your work, you can move policy to practice. Now, by training, I am a policy guy. There will be times when I sound a little bit like a clinician. I'm really not. and my wife can assure you that I should not do work on individuals. So I'm at my best at about 5,000 or maybe 50,000 feet in the air, and so I'm going to stay up there, but I'll come down a little bit. But again, you know, the hope here is that the presentation does something for you. It turns a light on. It reminds you about the work that you're doing ultimately, and gives you something to talk about and to think about over the next 2 days. So part of the framework that we have been working to realize over the last 2 years is a framework that says that it is really, 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 really important to get the child welfare system moving towards a focus on well-being. We believe that the reason children enter foster care is because they've been abused or neglected. And that for them to get to good outcomes in their lifetime, healing and recovery has to be a part of it. And that it is the work of the child welfare system to provide the opportunity and the resources for healing and recovery. We also really believe strongly that healing and recovery is an engaging process, a process that has to reflect the life experience of the children we're serving. It has to recognize the developmental competencies they need in order to succeed. It's got to recognize that in abuse, in neglect, children develop survival strategies, coping strategies that do for them in that bad place what they need. It's also the case that when you pick young people up and you put them in a better place, that doesn't in and of itself give them the coping skills to succeed in that good place. In addition, we think that there are lots of opportunities for people to stand between young people and bad stuff. And that's the environmental buffers. Those are the people who can help. Those are the experiences that can help young people be more resilient, find their own way in the world, achieve healing and recovery. And ultimately, we think it is those environmental buffers that allow them to go out into the world, not as Superman or Superwoman, but as young people, as young adults who can face adversity, overcome adversity, and respond well to adversity. Now, I recognize that that's a really, really high bar. And it's one that, as the child welfare director in Illinois, I was reticent to embrace. But it didn't take me long to realize that the children in foster care and the children who remain at home are begging for this. They're not just hoping for it, they're begging for it. Because they know that it is through that healing and recovery that they overcome, they succeed. And they are capable of doing something for themselves that often their parents couldn't do for them. And so part of this is a recognition that young people of all ages are begging for us to do something more than what we're currently capable of doing. And so that means helping to reshape the child welfare system, helping to build the capacity in the child welfare system to begin to address issues of social and emotional well-being. Now, I'm not going to try to convince you in the next 45 minutes that we have all of the resources we need to do that we have all of the knowledge base that we need to do that, and that we have all of the technical assistance to do that. But I think we have enough of all of those things to start to do that. So let me give you a metaphor that will make you a little more comfortable, and then I'm going to jump into my slides. As Jane indicated, I spent 2.5 years at the Chicago public school system. There I was the chief of staff, and I was really there to operate the day-to-day functions of the school system. So Arnie Duncan, the current Secretary of Education, was the CEO at the time. He needed to spend his time outside of that administrative office, building consensus, motivating principals, identifying resources, talking to the public, being engaged in a discourse about how you improve public education. So it was my job to stay inside the building and to make sure that he wasn't distracted by a boiler blowing up on the south side, or a principal getting arrested on the north side, or the decision about whether to keep the schools open or closed because it was 5 degrees below zero, and we knew that the phone lines would blow up if we didn't open schools for all the parents who still have to go to work. So that was my job. But at the same time, I went there with a certain mission, and that was to try to figure out how public education gets better. Because what I saw in the child welfare system was a group of young people for whom the current education system wasn't working. And there was lots of discussion about how to get better. There were lots of initiatives about how to get better. But during that time, I also was fascinated by the measure of success. The measure of success in the Chicago public schools was how many children met state standards in reading and math, and how many students exceeded the standards in reading and math. Now, on the face of it, that's great, right? That it's a school system that's saying measurement is important, and we're going to look at the fundamentals, and we're going to make sure that we're promoting math, reading and math. How that bold strategy was implemented was something of a challenge. So I've drawn a really bad diagram. It's not the one that's up there. It's the one that's on this pad here. There's one over there that hopefully looks something like the one over here. When I went to meetings of principals and teachers talking about how they were going to get better, this is how they are going to get better. This first line here was intended to be meeting state standards, and this line up here is intended to show exceeding state standards. So you would get evaluated, and you would come back, and the report would come back, and it would say 50% of students in your school are meeting state standards, and 25% of your students are exceeding state standards. But how that approach, how that policy, how that commitment got implemented were meetings where principals were taught how to identify students who were just below the meeting standard and figure out how to get them over the meeting standard. And it taught principals about how to identify students who were just below the exceeding standard and move them above the exceeding standard. It did not talk about at all all of the kids who were down here. No discussion whatsoever. So we had a visionary leader. We had commitments to do the right thing. We knew that we had resources to move forward. We adopted a measure of success. We were going to hold principals accountable. And the discussion they were having was that. I would suspect that everybody in this room who has a child in public education or private education hopes that their school is doing more than focusing on how a child moves from here to here and from here to here. Now your question is, why did he just spend the last 5 minutes talking about a silly chart that he could barely write about something that's unrelated to your work? The reason why I'm saying that is because I think today that's what we do in child welfare. I think as committed as we are, as motivated as we are, as purposeful as we are, we have reduced child welfare down to moving kids that we can move from one side of the line to the other. Moving those kids who we can get back home, back home. Moving the kids that we can get to adoption. Moving kids that we can get to subsidized guardianship. And what do they walk away with? And what about the kids who we can't get there? If we spent their entire time in foster care just focused on getting them to permanency, and it takes us 5 years to get them there, how many developmental tasks have they gone through and not achieved? How many stages of development have they gone through and missed opportunities? How many survival skills have they developed that make them incapable of succeeding in the world in which they're getting ready to enter? So the challenge, I think, to child welfare is to take the commitment that we all have and move to a different standard than just moving kids from meeting to exceeding and from below the meeting to above it. And so that's what we're going to try to talk about, and that's what we're trying to do. So when you think about child welfare, we want you to think about the whole child. And we want you to care about that, not just about the kids who are likely to go home versus the kids that get adopted. Because the challenges that they bring with, they're going to take with them, regardless of what vehicle was used to get them out of the system. And when they get there, we actually want them to be in a better position to succeed and not a lesser one. So the average child in foster care exits in 24 months. That's a lot of missed opportunities if all we're doing is focusing on getting them out. So we've got to find a way to multitask. We've got to find a way to both pursue well-being, even in the knowledge that ultimately our goal is to get them back home or to get them to adoption or guardianship. And if we focus on every child with that same commitment, then we don't have to guess which ones are right below and hope that we can move them above, that we make that investment in all kids. So part of your reaction is probably, that's all fine and dandy. Sounds really good theoretically, but what evidence do we have that they're really committed to doing that? Show me something that moves us in that direction. So here's an example. This year we made $28 million in grants intended to move the system towards better pursuing social and emotional well-being for children in foster care. So these are small investments, but they're the right investments. So we made an investment of a little more than $3 million so that we could better integrate a trauma-focused approach to practice in child welfare. So not just recognizing that kids have trauma symptomatology and saying, boy, they really need help, but specifically making funds available to help states begin to move in that direction. We also made a small investment of all the money we had available that we can make in also addressing the service system for older youth. and making sure that we're building into that system a strategy of service delivery that builds their capacity, that worries about the developmental stages that they're going to go through, and most importantly, help them figure out how to get to a place where they actually know how to have healthy relationships with other adults. They've had lots of modeling of bad behavior. They've developed lots of coping strategies that are about survival. Rarely does the service system focus on helping them build the skill and capacity to have healthy relationships with other adults. And just pushing them in front of adults doesn't do it. My wife can assure you of that. We also made some investments in early education. So not only are we having an education summit this fall that'll bring together directors of child welfare, directors of public education, and the court system together here in DC to summit on how we figure this stuff out, we also made money available for states and jurisdictions to come together and figure out at a local level how they get to better educational outcomes for kids who are in foster care. We also made investments in the family connections, trying to build on family group decision making so that we can begin to engage the whole family in this context of trying to move the child and the family forward. And we made about $13 million in investments on what we're calling our Permanency Innovation Initiative, which is really focused at targeting those individuals, those children who are least likely, those children that are down here, not here, to develop strategies to target them with the hopes of moving them forward in a way that the entire field can learn from. So we think these are the right directions to go. We think that's consistent with the message that I gave you. And if Congress gives us the same money they gave us last year, we're going to put that money in the exact same place because $28 million is not nearly enough to move the system where we want it to go. We also took the opportunity to work with Congress in the reauthorization of Safe and Stable Families to now include in Title IV-B language the opportunity to address the social and emotional trauma that is associated with maltreatment and removal from homes. That wasn't in there before. If you're a state agency today and you got Title IV-B money and you want to spend it on implementing trauma, you can use Title IV-B money now to do that. We also ask that states identify those young people who are at the greatest risk of maltreatment and target services to that population. And we included that language because we did not want to ignore the group of young people who don't get removed from the home but receive services in their homes, because what the data suggests is the young people don't look a whole lot different from one another. The kids who come in don't look different than the kids who don't come in, but the kids who come in get a very different set of services than the kids who don't come in. And so we wanted to be able to help states and encourage states to recognize that they ought to be thinking about those young people who are at the greatest risk, but who don't come in. Again, not trying to just focus on right below the bar, but to focus on the bottom where the kids need the most. Again, what we're trying to do is to move child welfare to a different place. We're trying to move it from a place that worries about risk of harm and about questions of custody to a system that really does focus on healing and recovery. So why do I think this is so important? And why do I think this is the right thing to do? Because everything I read in the literature suggests that this is exactly what we should be doing. So this is a great study. This is a study that was done in 1997. It was called the Adverse Childhood Experience Studies. Most of the people in this room have probably heard about it, but it was a study that looked at adults who were in the age of around 57 years old. There were about 17,000 of them. They were members of an HMO at Kaiser Permanente, and the CDC funded the Kaiser Permanente to look at issues of what experiences they had early in life and what effect did it have on their adult outcomes. This is not a child welfare population. These are white, middle class, folks with full-time jobs who have the benefit of privately provided insurance. This is a non-child welfare population. And what they found was, when they looked at these adverse childhood experiences, which included things like growing up in a home of an alcoholic, growing up in the home of a parent who had a mental illness, growing up in a family where divorce occurred, or growing up in a family where child abuse occurred. And what they found was, for folks who had more than 4 ACEs, they were more likely to be physically inactive. They were more likely to suffer from obesity. They were more likely to experience cancer. They were 2 times more likely to have heart disease. They were more than 2 times more likely to have a stroke. They were more than 2 times likely to have a sexually transmitted disease. They were 7 times more likely to be an alcoholic. They were 10 times more likely to be injecting drugs. They were 12 times more likely to attempt suicide. Again, this isn't a child welfare population. This is just people who were 57 years old, who had private insurance, who had experienced these adverse childhood experiences as young people. So the idea that we can do things for kids, we don't have to really worry about those adverse childhood experiences. We can just get them to permanency, and that in and of itself sets the path for great outcomes going forward. That's what we would hope for. But the reality is these adverse childhood experiences study suggests that that's unlikely to be the case. So why we ought to be worried about these maltreated kids is because these maltreated kids probably have more than 4 ACEs. And if they don't have them before they entering care and being in care, they'll have 4 after that. And we ought to be worried about the long-term implications of it. I was out in Seattle last week meeting with folks at the Gates Foundation. They actually commissioned a study for the entire state of Washington, a representative sampling of the ACEs study. And one of the really interesting things that they found was that if you had no ACEs, you had less than a 1% chance of being homeless. And if you had more than 6 ACEs, you had a 25% likelihood of having experienced homelessness. So maltreatment has a profound effect on the lives of young people. So if we have them for 12 months or 24 months or 36 months or longer, just keeping them safe. So we also can back this up in brain development. We can back it up that children who are exposed to chronic fear and anxiety, it reshapes the way their brain works. It reorganizes the way the brain works. It changes the architecture of the brain. It doesn't necessarily determine that they're going to be mentally ill or any of those other things, but it changes the way the body functions. And if a young person's going to succeed in the context of a reorganized brain, they've got to develop new skills. They've got to develop parts of the brain that they didn't develop before. And they've got to be able to develop skills that allow them to compensate for their basic approach. And this is true throughout adolescence. So it's not just the kids who come in. There's important literature that's really pointing at the impact of chronic abuse and neglect, as having a greater effect on adolescence than abuse that happens in early childhood. So we ought not just be worried about the kids who come in at 1 and 2 and 3 because of their brain development, because young people who come in at 11, 12, and 13 are also going through really important stages of brain development. And that brain development is being shaped by that chronic fear and anxiety. And so helping those young people who are 11, 12, and 13 develop skills and awareness that enable them to account for the prior experience and still succeed in a different environment is critical, and it's supported by the literature around brain development. Same thing around trauma. Really compelling literature out there that has findings about the impact of trauma on long-term well-being. Same thing around trauma and brain and relationships. There's actually a tie now between a child's ability to establish and engage in healthy relationships. They can tie that to brain development today. One of the most fascinating points that I've come across in the last couple of weeks is we've been looking at this issue of psychotropic drugs. And kids in foster care are prescribed psychotropic drugs at 3 or 4 or 5 times the amount as other children who are on Medicaid. Striking difference. But one of the things that I asked folks to look at for me using the INSCAW study was this one measure that they have around relationship skills. So they can actually look at the child's ability to engage in good relationship skills with their peers. And in this particular study, they divided those skill sets into good skills, medium skills, low skills. And I had them align that with the prescription of psychotropics. And if you had high skills, you had much less prescriptions. If you had low skills, you had a lot more prescriptions. So this slide here is from the INSCAW study. What it documents for you is the challenge across each of these areas of functioning for a representative sampling of children who come into contact with foster care. And those dark hashes that are in each of the bars, that represents the rate of these problems in the general public. So along functioning, mental health, trauma, cognitive development, overall development, behavioral issues, and relationship issues, this is what a representative sampling of children who come into contact with foster care look like, and those dark hashes are what the general public looks like. So again, making the point, picking a child up from a dangerous environment, putting them in a safe environment is a good first step. It's a necessary step. It's not a sufficient step. This is a slide that looks at children who left the system to permanence. And this actually looks at a slide of children who returned home. And they were assessed at a baseline prior to exiting. And then they were looked at 18 months and 36 months. The blue line is for children who remained in care. The orange line are the kids who left. So the kids who returned home by these lines had lower issues of internalizing behavior problems and externalizing problems. So you can see the kids who remain in care were more challenged overall than the young people who left care. But for the young people who left care that had internalizing problems, over the first 18 months, their problems actually got worse, not better. So exiting foster care in and of itself didn't change these kids' internalizing problems. It actually pushed them up. Over 36 months, they came back down, but you'll notice they didn't even come back down to the level that they were at when they left care on the internalizing issues. On the externalizing issues, they go up, they came back down about the same, but they certainly didn't make marked improvement in getting better. This is a slide that looked at kinship care. It looked at children who were placed in kinship care and they spent the entire time in kinship care, and then it gives you a gradation of less kinship care all the way down to the second to last column, which shows young people who were never in kinship care. And this is a study that looked at adult outcomes of mental health and well-being. And so these are actually adults. And what they found was whether it was any diagnosis, 3 or more diagnoses, major episodes of depression, panic syndrome, social phobias, general anxiety and disorder, and PTSD, that there was no difference statistically from the kids who spent their entire time in kinship care and kids who spent no time in kinship care. So again, kinship care for kids who are in care is a stabilizing factor. It's a systems level perfect opportunity. Kids are managed easier in kinship care than anywhere else. That's different than saying that from a social and emotional standpoint, they get better just because they're in kinship care. This is a group of young people who got adopted. So they were tracked when they were adopted, and they were tracked across the axis of mental health and well-being issues, their social and emotional competencies. So they looked at anxiety and depression, oppositional defiance, ADHD, antisocial behavior, peer problems, and overall behavioral health issues. So the blue lines, the blue columns you see, are 2 years post-adoption. The red line is 4 years post-adoption, and the orange lines are 6 years post-adoption. You notice those bars in most instances go up. And even when they don't go up and they actually start to come back down, they're still in the 30 and 40% range. So we know that there is this relationship between the environment, the nurturing environment, and we know that part of the challenges we have are a function of our own DNA. And it is the coming together of both the environment and the genetic makeup. It's that interplay that results in some young people being resilient and some young people being horribly impaired. And so we got to work at both levels for kids in foster care if we're going to enable them to get to adulthood and be able to function effectively in this very large world that they're entering. So this is a case to be made for, again, focusing on the social and emotional stuff. One, because we can find evidence that just getting the permanency doesn't get us there. Focusing on the social and emotional stuff is important because we know that the brain science says that we ought to be concerned and we ought to be thinking about it. Focusing on the social and emotional issues is important because the ACEs studies demonstrate the impact of early childhood bad stuff happening leads to bad stuff happening in adulthood. Now again, I'm not suggesting to you that we ought to be doing this and it ought to be the child welfare system that figures it out himself, because there are lots of other players in the lives of these kids. I'm also not asking you to embrace well-being across every domain of a child's life. But what I am suggesting is that we take the first step towards well-being by focusing in an area that we can clearly document where there is need. We can clearly document that there are effective interventions. And we can clearly document progress for a child at any point in time along a continuum of having been served. So we tried to identify a set of well-being targets but specifically around social and emotional capacity. So the ability to self-manage, having a sense of agency, understanding purpose, having confidence as a result of efficacy, having emotional intelligence, absolutely critical. It's measurable. We can intervene. We can help young people get better. Being able to be more environmentally aware and aware of their behaviors, effect on the environment, building their capacity to manage risk, helping them think critically, building the capacity to acknowledge, have the knowledge of the essential life skills, and having a positive relationship with peers, siblings, and adults. I'm not asking us to fix everything. I'm asking us to begin the path of moving towards trying to create this set of skills and competencies in young people so that regardless of when they exit care, they're more capable of functioning. So when they get to an adoptive family, they create less stress and they get more of what they need. So that if they leave through return back home, they're better able to ensure that they're safe and secure and they can move and protect themselves in ways that they may need to. And for those who unfortunately have the experience of aging out, we have a greater sense that they're going to get to a better place than they're in today. For the kids who age out, we looked at this issue of homelessness, and we looked at this issue of crime. And specifically for kids who age out, the kids who are at the greatest risk of being arrested for a crime are kids who leave with a mental health diagnosis. They're 4 times more likely to be arrested, not necessarily to go to prison and jail and all that other stuff. I'm not saying that that all happens. But what I am suggesting is those young people are very vulnerable. They have a limited skill set, and in the context of that limited skill set, we don't get them to good results. This is intended, these 2 slides actually, I won't go in great detail, but this is an attempt to show you for each of the concerns that I've raised, there are actually evidence-based strategies out there that exist today that the child welfare system could begin to adopt that would move us exactly in the direction that we want to go in. These are a set of interventions across those most common mental health diagnoses as well as trauma. These are evidence-based strategies that we could move to today to intervene. So the point of these last 2 slides is to demonstrate that all of this stuff is within our reach. And it's about thinking about our work differently. It's about moving our resources from one area to another. We're working with Medicaid and others so that we can help reshape those policies so that we can use those mental health resources in states to specifically target these issues. We're talking to deans in social work about can we help shape the curriculum that they're using and the strategies they use to recruit young people who end up being on the front lines in child welfare. We made the investments that I suggested to you earlier. We're trying to move policy so that things like Title IV-B can address issues as I've described them today. So we're trying to move on every front, and we know that you have a role because you guys are the folks that also are going to help us move these policy objectives into practice. And so I'm not asking you to carry this entire burden, but I'm asking you to recognize that there's someplace else we need to go in child welfare. We think that now the system is 30% smaller than it was 14 years ago. We think now that there are fewer African American children entering foster care unnecessarily. We think in a time where we have the capacity to achieve greater rates of adoption than ever before. We think this is the time to move towards just focusing on permanence and getting to at least the beginning of a well-being continuum. So I'm going to stop there. I've got about 15 minutes of time for Q&A. I hope that I have been provocative enough that you guys are willing to ask me really challenging questions. So let's have at it. Yes. If you could stand up and speak loud enough for everybody to hear you.
Okay. My question is just, I struggle continually with all the evidence-based intervention tend to be focused on the child and sort of an individualized focus, but then I see the families not able to support that in the children. And so intuitively, I keep coming back to if we don't include the family in our support of the children, we have really set it up to be a pretty ineffective measure. So,
Right. Fair critique, right? Issue comes up on a very common basis. Here's the important point to note. For each of these evidence-based strategies here, we actually reviewed them specifically for the purpose of determining whether there was a role for the parent in it. And we looked specifically at, did they address competencies related to the parents or caregivers? Was part of the manualized training specific skills and strategies related to the caregiver and parents? And the vast majority of the evidence-based strategies that we put on this list have a parent and family component. Because we know in foster care, the caregiver has the greatest impact on whether a child gets better, stays in the same places, or regress. And so we were very purposeful about making sure in the evidence, did they have strategies that specifically addressed the role of the caregiver and the parent? The vast majority of these do, and we're glad to provide more information for anybody who wants to poke around on these specific evidence-based strategies to learn more about where the parent or the caregiver is at in these interventions. And we're confident that there are programs across each of these major areas that if someone chose to pursue and implement, they have a parent or a caregiver component. Yes?
You mentioned that getting us to permanency doesn't get us all the way there.
I would frame it as it's necessary, but insufficient.
And on that note, yesterday we had a post-adoption summit. There was a number of programs in the United States that provide post-adoption services. So those programs are positioned to help parents get us there with kids and provide the right services and needed services. And yet we're at a time with budget reductions in many of the states where states are cutting their general fund dollars and then not accessing the federal funding. Is there any discussion at the federal level of changing the requirement for the match in order to access federal funding at this time?
So the easy answer is lots of discussion. The harder response is how much of that discussion is moving in a direction that's useful for states soon enough. And so the place where states are likely to benefit the most in the near term is in the Title IV waivers. So as a part of the passing of Safe and Stable Families, they also passed new flexible funding waivers that will allow us to make waivers available to 10 states a year and give states the flexibility to move the allocated amount of Title IV dollars up and down the continuum of service to get to better outcomes for kids. And if a state chose to do that by investing in more post-adopt services so that fewer of those children return to care over time, the waivers would certainly allow that to occur. So that's the most immediate benefit. We've also looked at the question of, do we have any administrative flexibility? Are there things we can do outside the statute? We think that there are some medium-term opportunities there. Because they're regulatory in nature, I probably can't talk about them, but we think there are some midterm issues that we can get at. We can create some administrative flexibility as well as some programmatic flexibility ultimately that move us in that direction. I think the really hard one is a strategy that says that at some universal level, we're going to be able to eliminate the match requirement. Because part of this is the child welfare is a partnership. And if the states don't have a stake in what we do, right, you get very perverse outcomes. If you recall, there was a time in the late 90s and into the 2000s in states that had state-administered but county-operated systems. And one of the early issues they had when the number of kids in foster care was growing greatly was that the counties were responsible for the kids, the states were responsible for paying for the kids. And they found that in the context of that fiscal dynamic, you had no obligation as a county to manage your population because you were going to get reimbursed for whichever kid you brought into care in your county. And what you saw over the late 90s and 2000s were a realignment of those policies. So counties and state governments had both had a stake in the decision about who to bring in and not bring in, both from a fiscal standpoint as well as from a programmatic one. So I don't know that the federal government's ever going to get to a place where we can waive the match requirement. I can't tell you that the Congress is in that kind of mood either. But ultimately, I think it's a good government issue here. At the end of the day, you want everybody to have a stake in the decisions that are made, and I think removal of the match obligation goes there. We have tried in lots of instances to push the match down as low as we could, and we have also tried to use the discretionary grants to move us in a direction by allowing folks who had the ability to match be the ones who could lead the edge and help us demonstrate that these are the right kinds of investments so that Congress can make more money available. I'll make one other point, which was in the 2012 proposal of the president. We included in that budget an increase of $250 million for foster care. And we specifically said that those dollars were intended to expand the array of services for children that you were trying to prevent from entering care, increasing the likelihood of children, addressing the social and emotional issues of children who were in care, and providing post-permanency supports, social and emotional supports for children who exited care. It is highly unlikely that Congress will act on that request of an increase of $250 million. But the purpose in that request was specifically around getting more resources to states, doing it through a performance-based system, but those dollars replaced the match requirement with a performance requirement. So it said philosophically, if you get better, you don't get fewer federal resources, you now could get more federal resources. And so we put that proposal in the Title IV-B category specifically to get at the concerns that you raised. I am confident that the administration, even if we don't get that money in 2012, will put that money back in 2013, and we'll ask for the same thing because we think that states are hurting, but we also think that states need to expand the array of services to better address the issues of kids in foster care, for the kids who exit foster care, and for the families that you're trying to keep together so that their children don't enter foster care. Yes?
I really appreciate your comments about the needs of the kids in foster care, and you seem to be going in the direction that it was child welfare's responsibility in some way to meet those mental health needs, but then you kind of pulled away at the very end. So I'm just curious, what would it look like?
Sure.
Who should they be partnering with? Do you have models of best practice examples?
Sure. So I think there are a couple of issues here. And we had to grapple with all of them in terms of getting to a place where the president would include an increase, right? Because the first challenge was convincing folks in the administration that child welfare was a place where there were enough good things occurring that we weren't pouring good money after bad. The second hurdle we had was to demonstrate that the resources that we would provide would encourage getting better. And third, we had to demonstrate that there was enough evidence that we could get better. So, let me answer your question specifically. We think issues like trauma are relevant across the spectrum of kids that we come in foster care. And today, most of those trauma-based interventions don't have a mental health diagnosis tied to them. And as a result, most of them aren't fundable through Medicaid. So we think there are groups of a subgroup of children in foster care that have social and emotional issues that don't rise to the level of a clinical diagnosis. And therefore, states can't leverage Medicaid as a way for paying for it. So we're saying we take the $250, we'll use our discretionary money to try to expand the array of services that aren't fundable under Medicaid, and at the same time work with Medicaid so they would be willing to align whatever policies they can to supplement those non-diagnosis services with those services for kids who have a legitimate mental health diagnosis for which Medicaid could be used. And so what we're trying to do is both. I can't take my child welfare money and spend it on mental health interventions, but child welfare spends a lot of its money on social and emotional issues where Medicaid doesn't play. So for example, as a state, we adopted subsidized adoption and guardianship very early. We had an early waiver starting in 2009. And as a part of those subsidies, I had to sign off on the amount of money that would go to those subsidies. We were spending, during the 4 years that I was there, $300 million in subsidies, and most of that money was going to counseling. Counseling. Most of those counseling dollars weren't Medicaid programs. And as a result, that money was going straight to counseling, right? And it didn't matter what issue the kid had when they came into care. It didn't matter what issues they had while they were in care. And it didn't matter what issues they had when they left care. All we were paying for was counseling. And so I would argue that we can use the president's $250, we can use our discretionary dollars to move states to a place where they're having a set of interventions that are addressing the issues that are covered under counseling, but are addressing them in a more evidence-based approach. At the same time, we try to move Medicaid as far as they're capable of moving in aligning those other interventions that we need and are supportable. We've looked at these evidence-based strategies, and we've actually found examples in states where they're using Medicaid dollars to fund many of them. But states have had to be really creative about how they went about doing that. So we're asking Medicaid, if the states that have found these creative ways of doing this are doing it within the policy, can we just clarify the policy so everybody knows how to do that? We're not asking you to change the policy. We're just saying, if Michigan can do it, why can't Illinois do it? And if we think that that would make a difference in child welfare, why can't we just bring the whole discussion up to the light of day and say, this is within the policy. If you chose to do this, this is what you'd have to do. So I'm not backing away from the obligation that child welfare has. We think they go together. But there are spendings that go on. Also, let's talk about two other areas that are obvious, right? One is group homes. There are a whole bunch of kids who land in group homes, and when you look at their profiles relative to all other kids in foster care, they have tons of social and emotional issues. Most of those young people don't receive services paid for by Medicaid, but those group homes spend a lot of resources trying to figure out how to manage bad behavior. So states are already making that investment. We ought to be helping them make the best investment by reshaping those group homes so that they better address the specific social and emotional issues that kids in foster care have. And we've also demonstrated in the last couple of years that most of what we're doing on the independent living and transitional living basis doesn't work either. We have 4 studies that have been done that have been published in the last year that demonstrate that the independent living and transitional living services that we're paying for through Chafee had no statistically significant impact on the young people who were served by them. So we think there are a whole bunch of kids and money that you're spending on social and emotional issues for kids already. We think there's money that you're spending in group homes ineffectively, and we think there's money that's being spent in the independent living and transitional living programs, none of which are Medicaid eligible, but all of whom have kids that have a lot of social and emotional issues who would benefit from the kinds of interventions that I'm talking about. So I'm not running away from child welfare. It's a partnership, but it's one in which child welfare is already making investments. We're going to help them try to make better investments. At the same time, we want to align our Medicaid policy so it is as supportive as possible without exceeding the authority that the CMS has to make funding decisions. So we think it's together. We're working closely with SAMHSA as another example. So on our trauma initiative that we funded, we're funding the programming side of it. They're funding the technical assistance side of it, right? Because we know they've got a large reservoir of knowledge around intervention supports. And so they're doing that. We're working with the Child Traumatic Stress Network, specifically to leverage their experience in child welfare so we can get to better systems. We're working with the Department of Ed because we know our kids struggle academically. We know a lot of kids in foster care have IEPs. We know many of those IEPs have behavioral interventions included in them. And we know that many of those kids don't get better as a result of those behavioral interventions that are in their IEPs. So we're looking to, can we work with the Department of Ed to think more strategically about what are the core set of behavioral interventions that districts ought to know about so that they can better serve maltreated, abused and neglected children. So we're trying to find partners who are willing to come to the table. SAMHSA is a good example, CMS is a good example, the Department of Ed is a good example. So I can probably take one more question. Who wants to have it? Back here?
Well, I want to thank you for your presentation. It was provocative. I do want to follow up on the parent question, but a little bit different angle.
Yes.
I talk a lot in my state about the fragility of the families that we're working with and the survival and coping skills of the parents that we're trying to help either get kids home or keep kids home. How do those parents fit in, and how can this help with those parents?
Great question. We are also thinking about those exact challenges for 2 reasons. One is probably about half of the cases annually that are substantiated result in that family not having their child removed. So in 2010, there were 460,000 children with cases of indicated abuse or neglect or substantiated cases of abuse. So 460,000 substantiations, there were 240,000 entries. So almost half of those kids remained at home. And so if we want to make sure that those children don't experience recurrence of maltreatment or reentry, we think we've got to intervene for those families. Unfortunately, in this presentation, we didn't include it, but we actually have similar data that takes and looks at the families of children who look like this. That also comes from the NSCAW data. And we also have a set of parenting interventions that we have identified that go to the specific challenges that parents are having, particularly those in which the child remains at home. So we could have, in a different presentation, swapped out the discussion about the children, replaced it with a discussion about the caregivers, and we could have done the same kind of presentation. We just opted to do the kids here. If I had another opportunity to speak to you, I might have spoke to the parent issue. We just made a strategic decision to focus here. But we think getting the social and emotional well-being has to be done in the context of moving the parents to a different set of skills, competencies, and capacity to deal with raising difficult children. So I would close my comments at this point where I started them, which is that I realize that what I've put in front of you challenges some of your assumptions, creates a little bit of sadness and frustration that the work that you're doing may not be producing all of the results that you wanted them to. But I would encourage you to take this presentation as license to both challenge what you do and challenge the folks around you. But do that in the knowledge that we're just not constructing a theoretical argument. We're putting the money where our mouth is. We're working with the other federal entities that have a role in child welfare, and that we're trying to, wherever there are legislative opportunities, to infuse in them issues of trauma, social and emotional well-being. We're doing that. So you've got concrete evidence that the federal government is moving in the direction that they are also encouraging you to move in. Use that as evidence in your own thinking and when you go back to your states to demonstrate that you can do more, you should do more, and the federal government will support you when you try to do more. So thanks and enjoy the rest of the conference.